Okay, good morning, everybody, and welcome to our panel, Law Enforcement and Mental Health Partnerships to Promote Resilience in Central Florida. In this workshop, you will hear about a unique community resource connection at the Orange County Sheriff's Office and presentations about two new mental health and law enforcement partnerships in Central Florida. And if you were in the opening session this morning, you did hear about one from Sheriff John Mina a few minutes ago, and that one will be highlighted, the Behavioral Response Unit. That is the first partnership we will talk about. The second is a partnership between the Orlando Police Department and Aspire Health, the community response team. Our first presenter is LaJuana Rains. LaJuana is the community engagement liaison for the Orange County Sheriff's Office. In her current role, Ms. Rains is responsible for creating, planning, and facilitating long-term strategies focused on reducing violent crime throughout the community. She also created the Community Resource Connection, which is a collaboration of agencies, grassroots entities, religious organizations, and volunteers whose purpose is to determine community needs and provide guidance and assistance. So LaJuana, give us a little bit of information and an update on this project.
Well, good morning, everyone. Hope everybody is awake and ready to get started today. Had a great day yesterday. So I want to talk to you about a program that I kind of run through the Orange County Sheriff's Office. It's called the Community Resource Connection. When I first came into the agency, I was in charge of bridging the gap between law enforcement and the community. And so that is awesome. Some of the things that we get a chance to do where we partner law enforcement with youth in the community, we partner law enforcement with seniors, just kind of bridging the gap. Well, I came up with this idea of how else can we connect, which will also help reduce some of the violent crimes. And so the CRC kind of came to my mind, which stands for Community Resource Connection, same acronyms as this meeting. But it is a collaboration of agencies. I have DCF, Social Security, there's law enforcement, there's church groups, there's grassroots entities. It's just a plethora of agencies who all support the community. And pre-COVID, we would go door to door and we would knock on the doors and ask the residents, how can we support them? Because what we find out is we give all the food, we give all the clothes, we donate and we help as much as possible. However, a lot of these families were still struggling with something that we didn't know. So if we can get into the homes and find out and they tell us, hey, I need a job, I need employment for, I need a daycare for my children, I need housing assistance. That's what our team does. So in the past, we all worked individually, but now we work collaboratively as a group. And we also go out and we say, hey, tell us what you need. And then we provide those resources to them. So the CRC now, post-COVID, we actually go out and do community events. We do food drives. Last year, we did probably about 6 or 7 food drives. And during the food drives, we just don't hand out the food. We go door to door, go car to car now instead of going door to door. We go car to car and we ask them, what support can we help you with that would help you so you're not back in this line again? And so we do a little survey and we take the surveys back at the end. I tally them all up and I provide them to those agencies that are a part of the CRC. So it's a great opportunity for those agencies to get outside of their cubicles, because normally we wait for people to call us. But to be a part of the CRC, you have to be willing to contact those residents who need the assistance, because everybody always assumes if you're in social services, oh, everybody know where we are, but they don't. So by having the agencies contact these individuals personally, it assists those families, because a lot of them don't have the education. They don't have the willpower to get on the phone and try to be able to talk their way through explaining what they need. So by us contacting them and saying, hey, you came to an event on this day, you indicated you need counseling, you need different services, it assists them even greatly. And I've had people call me back. At one point, I had several returning citizens to contact me, or their girlfriends would contact me and say, hey, thank you so much. He just got out. He now has a job. So it's being that behind the door person who supports these families. You know, the deputies will arrest. We can't stop that. You know, they have to do their jobs. But when the families are in need, that's where my team kind of comes in. And we kind of support the deputies. Deputies also will call me and say, hey, I have a family who is in need of food or who's in need of housing. Can you assist them? So it's kind of a wonderful opportunity because now the families get that one-on-one assistance versus struggling and back in the cycle again the next year or the next month or the next day. So that's kind of what the CRC is about. And like I said, I always share with people, if you want to become a part of the CRC, you have to be willing to do things the non-traditional way. So, and that's a little bit about the CRC, and later on, we'll get a chance to ask questions. So I'm just going to pass it on to our next presenter.
Thank you, LaJuana. Would you like to type any information into the chat, your contact information, if anybody's interested in joining your team?
I sure will. Thank you.
And we will have an opportunity for questions after our next couple presentations. Our next presentation is from Christin, Edwards-Salinas, and Sergeant Bruce Vail from the Orange County Sheriff's Office. This is a unique partnership, the Behavioral Response Unit, a partnership between the Sheriff's Office and Devereux. Christin has served as Devereux's Mobile Crisis Services Program Manager since June of 2015 and oversees the program, which started up in August of 2015, and the expansion of the program up through December of 2018. She oversees the clinical services provided by the counselors of the Behavioral Response Unit in partnership with the Sheriff's Office, which launched last December. Sergeant Bruce Vail has been a certified law enforcement officer for 28 years at the Sheriff's Office. He has worked in many divisions, from uniform patrol to major case investigations, and is currently the sergeant of the Behavioral Response Unit. So I will turn the floor over to Bruce and Christin to talk about the Behavioral Response Unit.
Thank you, Jeff, and good morning to everyone. We're just going to share our screen. We have a PowerPoint and talk you through a little bit about the program itself. The Behavioral Response Unit, we actually just started this year. So January 1st was our official kickoff. We started a pilot program, and right now we have two pairs or two teams working, which is two deputy sheriffs and two clinicians from Devereux. And they go out and they respond to calls for service, and they do follow-ups.
The clinicians for the team are master's level mental health professionals. They've actually served for several years in my mobile crisis program prior to this opportunity. So one is a clinical social worker and one is a mental health counselor. Both are working towards their licensure here in the state of Florida. And the deputies are crisis intervention team trained. So they've undergone over 40 hours of crisis intervention team training. And then together, as the teams were getting to know each other, they went through training, over 40 hours of specialized training for the unit, the clinicians and deputies together. And that's when the teamwork and the bond of the teams really developed.
Where this program came from is 2019, Sheriff Mina decided he wanted to bring a program or some type of program like this to Orange County. He tasked Major Torres with looking into it, working with Orange County government and looking at some different agencies around the country and what they were doing.
And since Devereux was already providing the mobile response services here in Orange County, we were invited to go along with the major and explore some of the co-responding models in Sacramento and LA. We got to do ride-alongs and kind of observe the different types of programs. So based on the services that we saw out there, the Sheriff's Office selected Devereux to be the contract for the clinical piece for the clinicians to join the Behavioral Response Unit.
On an average, the Orange County Sheriff's Office responds to roughly 8,000 mental health related calls annually. That's about 22 calls a day regarding individuals experiencing mental health crisis. Oftentimes, community members reach out to law enforcement for help in those cases, and law enforcement officers can choose between doing nothing, leaving the person there, arresting, or Baker acting. Very limited on what the law enforcement officers could do in responding. And what the clinician end of it does is it adds more ability for the law enforcement officers. Now patrol deputies that are responding to calls for service can request the specially trained BRU team with the clinicians to respond out there to assist.
And the clinicians are able to assess all kinds of needs of the individual or a family. They can figure out what would be the best kinds of treatment and services for the family or individual to access. They can actually help with those referrals to those services, keeping the individuals engaged by doing the follow-up, making sure that they're making those appointments, coordinating care with the providers that they're referred to. And when the unit is responding to the scene, the deputies are also there to ensure that everything is safe, so that the clinician can engage with the individual kind of, in going over what the options are, what the services are, de-escalation strategies, while the deputies kind of keeping an eye on the entire scene, making sure that everybody stays safe through that intervention. And the goal of the unit is to help de-escalate these mental health situations, help there to be some resolutions, and reduce the number of arrests and Baker Acts for individuals that are experiencing mental health concerns.
This is the,
No, please.
jumping ahead. These are the deputies, the current teams that we have right now, the two teams. So as you can see, the uniforms are a little bit different. And you want to talk a little bit about why?
Sure. Yeah. So when we went out to Sacramento and Los Angeles, the major and I really observed some different just styles of teams. And what we liked most was the option for the deputies to be kind of dressed down. So they're not in like the starched uniforms. They're in a little bit more casual, so khakis and polos. But we did think it was really important for the clinicians to look like a part of the team without looking like a deputy or an officer. So they're in a different color polo. Well, we have the same logo. It's on the back, the clinicians have the word clinician and the deputies have the word deputy to kind of help people that might arrive on the scene know who these folks are. So it's clearly defined that way for them. So this is the uniform that they wear day in and day out when they're responding to these calls, so that they're easily identifiable as a team, but that as the professions are separate, the uniforms do have a little different look.
They also drive non-traditional vehicles, a little bit non-traditional. So they drive unmarked vehicles so that we're able to respond to calls for service at people's houses and don't stand out quite as much as being law enforcement at the house and neighbors looking, maybe some embarrassment or some negative effects by the people that live there or the people that are receiving services. The vehicles themselves also have a single partition in the back. What that allows is the deputies, if they have to Baker Act somebody, they can put the person in a secure area in the back. It's plexiglass and it's a single seat. They can do the transport, which leads to the seat next door to them and the back seat open. So the clinician can actually sit in that seat and talk to the individual while we're going down to a crisis center to continue the de-escalation while they're driving across town or to the receiving facilities. This is our contact information, and we'll also post it on the side. I'm going to unshare and talk just for a moment about, I think we're back now. Just to talk a little bit about where we are right now with the program. We really kicked off on January 1st. We have about 1,200 incidents that have been logged that we've been keeping track of that involve mental health and mental illness. And right now for the two teams, they have worked about 450 incidents, referrals. That's between calls for service where deputies are receiving active calls for service and follow-up cases. So as a deputy sheriff may be working midnights or weekends or a time we're not working, they receive a call for service that really is related to mental illness or a Baker Act. What they're able to do is they're able to send us the information. I'm able to assign it to one of the teams and they can go out and do follow-up. So whether or not the person was Baker acted or when the person is released, go check on them in the community, see how they're doing, see if they need any additional resources, making sure that they are on the right path to a successful life. And we'll stay with some of those people for a long time.
And the community response has been really positive. The clinicians are constantly reporting that they're being thanked and they're being told that they are helpful for these situations. So that's always really rewarding to hear as well. So we're hoping that this program can continue to make a positive impact on the community and our community members, and hopefully grow so that we can serve even more folks that need the help.
Yeah, we have both people in the community that are calling and requesting the BRU unit respond out to help their loved one in crisis. And we also have a lot of the deputy sheriffs that are regularly calling for assistance while they're out there working. So again, we'll post the information, our contact information, a little bit about the program here in the slides. And thank you very much for your time.
Thank you.
Thank you, Bruce and Christin. Wonderful program. 450 cases already in 3 months, 4 months. Quite a big number. So now let's jump to another big agency, the Orlando Police Department, who's partnered with Aspire Health to start the community response team, a very similar program. Our presenters are going to be Captain Lovetta Quinn-Henry. She joined the Orlando Police Department September of 2000, a very good friend and personal friend of mine. Hello, Lovetta. Sorry we can't be together today, but I hope all's well. In her current assignment, the Community Relations Division, she is the commander there. She and her staff work with community stakeholders, residents, and business owners to ensure safe and livable neighborhoods in the city of Orlando. Her partner this morning is Erin Martin with Aspire Health Partners. She is the Vice President of Patient Access. Her area involves the Access Center, the Central Receiving Center, Crisis Intervention Team training for law enforcement, which we do a lot of training at the School of Public Safety with Erin and her team for our law enforcement and corrections officers. And she has the mobile response team. So do you all want me to present the presentation, or will you do that?
If you can share the screen and we'll just kind of talk through it, and I'll just let you know when to advance it if you would. So first of all, I want to say thank you for having us here. I think Erin and I both, we're just overjoyed to always share about what the community response team does. So thank you, Dr. Goltz. Thank you for the other presenters, and thank you to Valencia and our wonderful partners, Peace and Justice Institute. So without further ado, we want to just kind of jump right in. I know we're limited on time and we could probably talk all day about it. So really the community response team, if you'll advance the slide and we'll go to the next one. Law enforcement has done a phenomenal job with the best tools that they had to handle individuals in crisis. We know this. We've done the best that we've known how. However, the mayor early last year about this time, went to several community meetings as well as listening sessions, and he heard our residents in the city of Orlando. They wanted a different alternative or response to those individuals in crisis. And so the mayor tasked the police department and other members of the city of Orlando to come up with the committee to really explore how we can deliver better services. With that said, in September of 2020, we came together and we identified the best way to handle calls and to actually meet their needs. And with that, we looked at the two models, the co-responder model as well as the alternative response model. And based on what we learned, the alternative response model we thought was going to be an advantage simply because our residents were asking for police not to come to those individuals in crisis, to give them those people that are more trained with that. So it was my pleasure, as I was chosen by Chief Ralone to spearhead the project, it was my pleasure to pair with Aspire Health, and we had full support from our commissioners, the chief, and the other officers, because again, we thought we were doing it correctly, and most often we do, but we know that law enforcement is really limited. And as Sergeant Vail said, you know, we either bake or act, leave them in place, or sometimes we arrest. And so we realized that that's not always the best practices. Connecting individuals with services was the biggest advantage, and that's what we were hoping to do. So City Council approved our one-year program, and we began with in January 1. However, and we'll go through December. However, our team actually came into service after training February 1. So the program criteria, I won't go into a lot of detail about it, but what we know for the purposes of the pilot program, we had to pick the types of call that we thought would be the most impactful and to meet those immediate needs. And those were the attempted suicides, the mentally ill nonviolent, those individuals who did not have a history of violence. And we knew that there were certain ways that those calls would be initiated. Usually the citizens would call into the 911 system asking for help, officer initiated, or via phone calls to between the dispatcher and the law enforcement officers. And so we looked at the criteria on the best way to do that. The phone calls would be connected through Access Health or to Access Health. The officer initiated via the radio, as Sergeant Vail said, the same way our officers would be on scene, asking for our community response team to come out and assist them with the call, or again, through 911, when an individual in community is calling and saying that they would like to use the services of the community response team. What we know, we had to create different dispositions. The radio dispositions is more to assist us with tracking and understanding how well we're delivering those services to ensure that the program is really meeting the needs and how we can maybe adjust along the way as we continue to develop the pilot program. So what's interesting is that after we talked back and forth, we kind of came up with the name Community Response Team because we do want to deliver services. We want to be there to protect our individuals in crisis, those who are calling the police. We didn't want to go out as a team with more of a medicinal name, simply because we have to protect their privacy, and we want to ensure that people would use the program, that they would feel comfortable, you know, utilizing the services. And so after some conversations between our partners with Orlando and Aspire Health, the Community Response Team name was born.
And from that, we identified the best call time. So the shifts were determined based on the call volume of those types of mentally ill, mental health related calls that were coming into dispatch. So OPD came up with, here's the shifts where we're seeing the highest call volume, and Aspire's teams were born. We created 2 teams of 2. We have a licensed mental health counselor and or licensed social worker paired with a case manager and somebody who has lived experience or either themselves in recovery or their loved ones where they have lived experience with mental illness and recovery, substance use, those types of things. So those individuals respond in teams of 2. They go alone without law enforcement, and we had extensive radio training, that went both ways with the communication center with dispatch, and then also to our team. The team does carry the police radios. They were trained extensively on how to use those radios and learn all the signals and codes and dispositions, and from there they respond to calls based on those. This is the team. So you can see we have 2 teams of 2, and then we also have a pool person meaning somebody who can be on call and back up when somebody else may be out on vacation or out sick that day, that can step in. And that also helps us with the data collection, because a big piece of this is being able to collect the data and track everything and analyze that data and be able to prove the outcomes, which have been very successful so far. And so like the BRU, we too have a non-police vehicle for this. We do have it marked, but we have it marked as a community response team. So it's identifiable, but it's also kind of HIPAA protected, because we're not saying mental health on the vehicle, but we're just saying community response, because that's what we're doing. We're responding to any concerns in the community that somebody may need. Dispatched from patrol, called out from patrol who's on scene, who thinks that the team may be able to benefit the individual in need of services, and or sending referrals after the fact.
So when the call comes into our communication center, the desk operator will actually triage the call and determine whether or not it's the call appropriate for the community response team. And then they generate the call for service, and then they send it over to the actual radio dispatcher. The radio dispatcher then would call the community response team and convey the address and the need of the individuals that they're responding to. One of the unique things that we did as a safety aspect is when the community response team comes on their shift at the beginning of shift, there's an all call over the radio so that all members at the sound of the radio could actually know that this community response team is available and they're in service. It also lets those sector supervisors know where the team is at all times. So when they get a call, they're dispatched out, they let the watch commander or the lieutenant on shift know, as well as the supervisor. And then the officer within those districts are also aware of where the team is. So in case they need them for transport for Baker Acts or anything of that nature, they're actually aware of where they're located.
And then when the team comes out, they are obviously responding to the individual in crisis and assessing what the need is. They are identifying, mental health symptoms, substance abuse involvement, the family dynamic, what's going on in the home, and they're able to assess and identify appropriate referrals and resources, both at Aspire and in the community, that may be able to assist that individual. And, so they are providing brief and crisis intervention counseling in the moment. They're also evaluating the need on an ongoing basis. They're making those referrals, and then they're following up with those individuals after the fact to say, okay, were you able to attend your med appointment? Were you able to connect with this counselor? And if not, okay, let's see if we can get you connected to someone else then, if that particular first referral did not work for you, or they missed their appointment or whatever. So they've got that continuity of care and that follow-up.
Our patrolled officers actually do the transport for voluntary and involuntary. They also provide that support for our team when they go to locations and they feel like they need the presence of law enforcement, or they may provide traffic. And so patrol's responsibility is not as heavy as it normally would be with these types of calls, because we have really trained them and made them understand that our CRT is really well trained and well familiar with how to meet the needs of the individuals in our community. So I will wrap it up with some of this. We have, in 2019, Orlando Police Department handled over 20,000 calls for service. And though our team is handling 2 specific types of calls, we believe that they have really made an impact just in their first 30 days of being available and starting the program. And so we are optimistic that if we move on, or when we move on to adopt an overall program, we're going to be able to expand it. But they have really done a phenomenal job in just the first 30 days based on the data that we're tracking.
I want to thank all the panelists because what we've heard so far today is just extraordinary partnerships between law enforcement and our community, especially the mental health community with Devereux and Aspire Health. I wanted to share one graphic in this workshop that I'm going to share in a community panel later this morning. And it really simplifies our work as first responders, especially at the School of Public Safety. In a nutshell, this all evolves around adverse childhood experiences, which we've heard about yesterday and we will hear more about today, which is leading to disrupted neurodevelopment, which leads to social, emotional, cognitive impairment, which at the end of the day is going to lead to a response by first responders and even in the correctional facility. That's why it's so important for us to partner with our mental health experts, because what we come in contact with as first responders in law enforcement is anger, violence, just acting out, disrespect, criminality, victimization, substance abuse, and addiction, which all is leading to the mental health challenges that we have as first responders. So this is really extraordinary work that's happening in our community, and it has just started. Again, I'm amazed, 450 cases already by the sheriff's office. And Lovetta, I'm sure you're going to be building up numerous responses and cases in your work as well. But really, in a nutshell, it's really everybody's all together and all in on this. We have to be. So what I'd like to do now is open it up to any questions in the chat. I don't know if we can have verbal questions, but if anybody has anything in the chat, please, or any questions, they can put them in the chat. Eric, you're here to help us.
Yes, we have a Q&A feature. If you click just to the right of chats, Dr. Goltz, you should be able to see several awesome questions from our participants.
I got it. Okay, I see
All right.
Several.
And I'll leave you and the panel to moderate those questions, and I'm here
Perfect.
for any support.
Thank you. First question that I have on the screen: would an individual experiencing a mental health crisis due to substance abuse disorder have officers, CRT, or BRU dispatched to them? How will you overcome aversion to calling police in such cases? Would anybody like to answer that?
Yeah, from the sheriff's office, our teams are co-responsible, so they actually would be able to respond out to the calls for service, so they'd already be out in the community when the teams are working. We do ask that the patrol deputies respond first and make sure the scene is reasonably stable, because we want to protect our clinicians and make sure that they are safe. But we are responding to those actual calls in the community on a regular basis, whether it be mental health or mental illness, or we've responded to some PTSD related cases and also some substance abuse cases, or coupled with mental health already. And they respond out, they assist the patrol deputies. And in most of the cases, they're able to take over that call for service, allow the patrol deputy to respond to other calls for service, where the BRU team will take over the entire call.
And in our case, because we're not responding with law enforcement, that does sometimes reduce the fear from the individual who's contacting for assistance with a substance use disorder, because they're of course concerned that they're going to be legally in trouble, and that is not our focus. Our focus is to get them the treatment that they need. So by responding, alone to that with all the safety protocols in place, that kind of reduces that concern by them.
Thank you for the response. Here's one that's looking into the future a little bit. Have we been able to track mental health outcomes for the community members who may be subject to these calls, kind of projecting a response? Would anybody like to respond to that?
I can speak to that. In our case, we are tracking every call and every referral made, and then we're following up on those referrals. So yes, we've got data being tracked and analyzed and put together, and we'll be sharing that on an ongoing basis as at the appropriate times. But we're tracking the outcomes and the follow-up attendance of those follow-up appointments and referrals and so forth.
Yeah, so we are as well. We've been tracking every single one of them, whether it be a deputy that's responding when the BRU team is not available, and also the BRU teams when they're responding. So we are tracking all the calls related to mental illness and or mental health and substance abuse.
I'm going to lump a few questions here together. First, are we going out into the community and talking about these programs? Second, are there any other municipalities in Orange County or in our area doing it outside of Orange County Sheriff's Office and Orlando Police Department? And are we serving adults and children and teens? So a lot there if you all want to just quickly comment.
So we are actually serving adults and children. And that's the wonderful thing about the CRC or CRT. We're actually able to go into the schools if, it's requested, and having that clinician, connect the individual with services as well as parents. So yes, to answer that part of the question. And I will tell you that since we started our program, there have been several municipalities here in Central Florida that has reached out asking for the model that we're using. And, we're definitely collaborating and sharing information in that regard.
Mhm.
Yes, and the same with us. We've had a number of different agencies come out and ride with our BRU teams. I think a lot of agencies are looking for their answers as well for different communities, whether it be county, sheriff's office, or different cities right here in Central Florida. So I really think between the teams, it's really going to grow. A lot of the municipalities are going to see similar programs to what we're doing between us and Orlando. So yes, I think it is kind of like starting the spark that's probably going to spread throughout Central Florida.
If I could say this, one of the things that really, for me, as a veteran in law enforcement, it really has ignited that flame within communities. Lots and lots of people are really asking for how we came across these different models. The sheriff's office as well as the Orlando Police Department, it's two different models. But the beauty of it all is we're there trying to connect individuals to services in the community. So it really is the push in the right direction to really answer communities' call, to give them a different response to, law enforcement and being able to connect to services.
I'm going to lump a couple more together because of the time frame we have. There was a question about, again, going back to, is this for children, teens, and adults? How about victims of sexual battery cases? Are there any other scenarios involving mental health crisis that this practice would be used and a law enforcement officer would be dispatched? So again, a cluster of questions, if anybody would like to respond to that as well.
Sure. With the victims of sexual battery cases, things like that, we do have victim advocates that are specifically trained for that, and they do a great job working with them already. If there was a call for service about an instance going on in the community or crisis or something like that, the BRU team would be able to assist and would respond. So yes, we have. We've also been working on some instances, not only with the individual, like we've had a couple of cases where young people have attempted to harm themselves, and their siblings have actually witnessed it and been the callers. So our teams have actually been able to work with not just the person who was in crisis, but also their family members because they witnessed that. The other part is with the adult, we primarily focus on adults. We do work with our school resource. We do work with juveniles. Fortunately, and I'll let Christin answer that one because she is dual role in that.
Right. So with our unit, we're encouraging the units to work really well with the mobile crisis program that Devereux also has that specializes in youth and young adults 0 to 24. So when they're asked by an SRO, a school resource officer, to respond to a school, either of my units actually can be dispatched to those calls to assist. So we've got a good plethora of availability of clinicians to respond to those kinds of mental health situations for the youth and young adult. And then the BRU's main focus is on the general community of adults that my other program hasn't been able to serve for the last few years because of the barrier with the age range. So the BRU has really been kind of a gap filler for us and my team so that we can serve and assist those the adults in the community as well.
I'm not going to leave you off the hook here. This last question's for you because we only got a couple minutes left. There was a question about a connection between with a local church, a Lazarus project. I don't know if you're familiar with that, but do you work closely with other church groups, other sectors of the community in your program?
Yes, as a matter of fact, I just found out about the Lazarus program about 2 weeks ago on a call. And so I got the young lady's information and I'm going to call her this week. It's actually on my to-do list. So yes, I do partner with a lot of churches. As a matter of fact, a lot of the volunteers that come out are from different faith-based organizations. And I just had a pastor reach out to me yesterday about a program that I currently run through the sheriff's office, which is called Girls with Pearls, Guys with Ties. And basically it is a mentorship program between law enforcement and those youth who are already in the system. And it partners them together to get the youth to understand that law enforcement is not against them. They're actually here to support them. So, and we do have this pastor who wants to partner. So I'm always looking for different agencies and entities who want to partner, and we collaborate together because it's all about bringing one resource together with another and getting it all done instead of everybody working individually to make it happen. So yes, I do work with church groups, grassroots, and I even have just volunteers from the community who want to come out and help. So anybody is welcome. My information is in the chat.
Thank you. This has been an all-star panel. We're at the end of our panel discussion. It's almost 9:45. I just want to end with one note. First, I want to thank you all for joining us. It's been a wonderful 45 minutes together. And as we expand these partnerships, really what it's going to help do is build a resilient community. And that's what this is all about. So thank you all for participating this morning.
Thank you.
Thank you.
Thank you, panelists. Thank you, Erin, for joining.